Have you ever had that weird, nagging pain in your foot? You know, the one that just doesn't go away. That burning, tingling feeling that makes you wonder what on earth is going on down there. Well, you're definitely not alone. Today, we're going to unravel a condition that might just be the culprit, tarsal tunnel syndrome.
All right, let's dive right in. What does this mystery pain actually feel like? Let's get really specific about the symptoms because you might start connecting the dots with what you've been feeling yourself.
Okay, I want you to imagine this. It's like a tiny, invisible fire inside your ankle, or maybe like a low-level electric current just humming through your foot. It's not usually that sharp stabbing pain you get from a sprain. Nope, this is more of a constant, distracting, and seriously annoying discomfort. So let's break down what that can really feel like.
So, does any of this sound familiar? That burning feeling, the classic pins and needles, maybe even some numbness? It's super frustrating, right? Especially when it seems to get a whole lot worse after a long day on your feet or even wakes you up at night. If you're nodding your head right now, you are absolutely in the right place.
So, what is actually causing these bizarre sensations? To really get it, we've got to peek inside the ankle. So, let's get into the anatomy and see exactly where this whole problem starts.
Here's the easiest way to think about it. You've heard of carpal tunnel in the wrist, right? Well, this is basically the carpal tunnel of the foot. It all comes down to one critical nerve getting squeezed. And honestly, that's the key to understanding everything else we're about to talk about. Picture a tiny, and I mean tiny, crowded highway that runs right through your ankle. On one side, you've got solid bone. On the other, you have this really tough, thick ligament. And squeezing through this narrow little passage is a super important nerve. As you can probably guess, it doesn't take much for a traffic jam to happen in there. And here is our main character in this whole story, the tibial nerve. This thing is the communication cable to the bottom of your foot. It's what lets you feel the ground beneath you. And it runs smack dab through that crowded little tunnel we just mentioned. So when things get tight, this nerve is the first one to cry for help. So how does that squeeze actually happen? Well, it really boils down to two main scenarios. The pressure can come from the inside. Think of things like swelling from tendinitis, or maybe a small cyst that decides to grow right inside the tunnel. Or the pressure can come from the outside. Maybe an old ankle sprain caused some inflammation, or maybe it's just the way your foot is built, like having flat feet, which can slowly stretch the nerve and narrow that tunnel over time. Okay, so you've got the symptoms, you get the anatomy, but how does a doctor or a physical therapist figure out for sure that tarsal tunnel syndrome is the real issue? Well, it's kind of like a bit of detective work. You know, this whole investigation, it always starts with you. Your story, what the pain feels like, when it started, what you're doing when it flares up. That gives your clinician the most important clues. From there, they'll move on to a hands-on exam, and only if they need to, some more advanced tests. And this is where your doctor gets to be a detective. They'll use their hands to gently press and probe, searching for clues. There's this one classic test called Tinel's sign, where a simple, gentle tap right over the nerve can send that familiar zinging feeling down into your foot. It's so simple, but it can be a really powerful aha moment that pinpoints the problem. Now, if the hands-on exam isn't quite enough to crack the case, it's time to bring in the high-tech gear. You can think of a nerve conduction study as an electrician checking the wiring in your body for a bad connection. And an MRI or an ultrasound, that's like getting a super detailed blueprint of the tunnel itself to see exactly what's causing the traffic jam. All right, you've got a diagnosis. Now for the most important part of all, right? What in the world can you do about it? Let's talk about the different paths to finding some relief. You know, the overall strategy is actually really simple. The entire focus, the whole game plan, is just to create more space for that poor, compressed tibial nerve. That's it. If you can give the nerve some room to breathe, you give it a chance to heal. When it comes to treatment, there are basically two main roads you can go down. And here's the good news. You almost always start on the scenic route. That is, conservative, non-invasive therapies. It's only if that path doesn't get you where you need to be that you might have to consider the more direct medical route. Physical therapy can be an absolute game changer in this fight. A great physical therapist is kind of like a mechanic for your foot. They'll fine-tune your alignment and give you the tools to help fix the problem yourself. They can teach you these things called nerve gliding exercises, and I want you to think of it like gently flossing the nerve to get it unstuck. And they'll help you build up a stronger, more resilient foot overall. Okay, let's be super clear about this. Surgery is the exception here, not the rule. It's a powerful option, for sure, but it's one that's usually only brought out after all the other options have been tried and haven't worked. It's kind of the break glass in case of emergency solution for tarsal tunnel.
Woo! Okay, we have covered a lot of ground, from symptoms and anatomy all the way to diagnosis and treatment. So let's bring it all home and just nail down the absolute key points that you should take away from all this.
Here it is boiled right down. First, that weird pain you're feeling, it has a name. And just knowing that can be incredibly empowering. Second, remember, it's really just a mechanical problem, a pinched nerve. That's it. Third, please don't guess. Getting a proper diagnosis is essential so you're treating the right thing. And last but not least, be hopeful. For so many people, the conservative, non-surgical options really do work. You know, your body is almost always trying to tell you something. The real question is, are you listening? Understanding what's behind your pain is truly the first step on the road to getting better. So if any of this sounded familiar today, don't just ignore it. Talk to your doctor, maybe see a physical therapist, and start taking back control. Thanks for tuning in.